Welcome. Have you ever heard of a disease where your own immune system attacks parts of your brain, leading to movement problems? Today, we're diving into the world of autoimmune movement disorders, a group of conditions where the body's defense system mistakenly targets the nervous system, causing a variety of movement-related symptoms. Join us as we explore the causes, mechanisms, symptoms, diagnosis, treatment, and future directions in understanding these complex and often debilitating conditions. What causes these autoimmune movement disorders? The exact triggers remain a mystery, but it's believed to be a complex interplay of genetic predisposition and environmental factors. In essence, the immune system, which normally protects us from foreign invaders like bacteria and viruses, gets confused. Instead of targeting these threats, it starts attacking healthy tissues in the brain, specifically those areas responsible for controlling movement. This misdirected attack can be initiated by a preceding infection, cancer, or even the use of certain medications. The body produces antibodies that mistakenly target components of the nervous system, leading to dysfunction. The exact mechanisms that tip the balance toward autoimmunity are still being actively investigated. Let's delve into the pathophysiology, or how these disorders actually work. When the immune system attacks, it primarily targets structures within the brain that are critical for motor control. These can include the basal ganglia, which are involved in regulating movement and procedural learning, the cerebellum, responsible for coordination and balance, or even connections between different brain regions. The antibodies produced in these disorders can directly damage nerve cells, interfere with neurotransmitter function, or trigger inflammation within the brain. This inflammation can further disrupt neuronal communication and contribute to cell death. The specific brain regions targeted and the type of immune response determine the specific symptoms and severity of the disorder. Understanding the epidemiology, how common these disorders are, is challenging because autoimmune movement disorders are often underdiagnosed. They are relatively rare compared to other movement disorders like Parkinson's disease. Estimates suggest that autoimmune mechanisms may play a role in a small but significant percentage of movement disorders. Certain populations with pre-existing autoimmune conditions may be at higher risk. Ongoing research is crucial to accurately determine the true prevalence and incidence of these disorders across different populations. The signs and symptoms of autoimmune movement disorders are varied and can be quite debilitating. They manifest as a wide array of movement abnormalities. Some common symptoms include involuntary movements like tremors, chorea, jerky, dance-like movements, dystonia, sustained muscle contractions causing twisting postures, and myoclonus, sudden, brief muscle twitches. Patients may also experience rigidity, slowness of movement, bradykinesia, problems with balance and coordination, ataxia, and difficulty initiating movements. Cognitive and psychiatric symptoms, such as memory problems, anxiety, and depression, can also occur. The specific symptoms and their severity depend on which parts of the brain are affected by the autoimmune process. Diagnosing autoimmune movement disorders can be complex and requires a thorough evaluation by a neurologist specializing in movement disorders. The diagnostic process typically involves a combination of clinical assessment, neurological examination, blood tests, and neuroimaging studies. Blood tests are essential to identify specific autoantibodies that target the nervous system. These antibodies can provide crucial clues about the underlying autoimmune process. Neuroimaging techniques, such as MRI of the brain, can help rule out other conditions and may reveal inflammation or structural abnormalities. Sometimes, a lumbar puncture to analyze cerebrospinal fluid (CSF) is performed to look for signs of inflammation or antibodies within the central nervous system. Because many of the symptoms mimic other conditions, accurate diagnosis is critical for appropriate treatment and management. While not all autoimmune movement disorders are classified into distinct types, certain conditions are frequently encountered. Examples include Sydenham's chorea, which often follows a strep infection, autoimmune encephalitis presenting with movement disorders, and some forms of paraneoplastic neurological syndromes, where the immune system attacks the nervous system in response to cancer. Additionally, certain conditions like autoimmune cerebellar ataxia and opsoclonus, myoclonus syndrome are recognized as specific entities. Understanding these different presentations helps guide diagnosis and treatment strategies. The treatment of autoimmune movement disorders focuses on suppressing the immune system and managing the symptoms. Immunosuppressive therapies, such as corticosteroids, intravenous immunoglobulin, IVIG, and plasma exchange, are commonly used to reduce the autoimmune attack on the nervous system. These therapies can help to decrease inflammation, neutralize autoantibodies, and promote neuronal recovery. In addition to immunosuppression, symptomatic medications are often prescribed to manage specific movement abnormalities. For example, medications may be used to control tremors, reduce dystonia, or alleviate chorea. Physical therapy, occupational therapy, and speech therapy can also play an important role in improving function and quality of life. Unfortunately, there are no definitive ways to completely prevent autoimmune movement disorders. Because the exact triggers are still largely unknown, preventive measures are limited. However, prompt treatment of infections, particularly streptococcal infections, may help to reduce the risk of certain conditions like Sydenham's chorea. Maintaining a healthy lifestyle, managing stress, and avoiding unnecessary exposure to potential environmental triggers may also be beneficial. If you have a family history of autoimmune diseases, discussing your concerns with a doctor is always a good idea. The prognosis for autoimmune movement disorders varies significantly depending on the specific condition, the severity of the symptoms, and the response to treatment. Some individuals may experience complete recovery with appropriate immunotherapy, while others may have persistent symptoms despite treatment. Early diagnosis and aggressive treatment are associated with better outcomes. Ongoing research is focused on developing more targeted and effective therapies, as well as identifying biomarkers to predict treatment response. Emerging therapies, such as monoclonal antibodies targeting specific immune cells, hold promise for improving outcomes in the future. Understanding the long-term effects of these disorders is an active area of investigation. The future of research includes a deeper understanding of how and why autoimmunity affects the brain, and to find the most effective methods to stop or prevent these diseases.